We did our project on acromegaly, and acromegaly is a rare disease where the pituitary gland produces too much growth hormone. Acromegaly is described from the Greek words acros, meaning extremities, and megas, meaning great. And there are many symptoms. Excessive growth hormone can cause enlargement of hands and feet, spacing of teeth, snoring, deeper voice, sleep apnea, and colon polyps. And because of the tumor size, visual loss, stock effect, fatigue, decreased libido, sexual dysfunction, jaw enlargement, and enlargement of frontal bones can occur. And this is a normal hand and a person with acromegaly's hand. And as you can see, the fingers are much larger than that of a normal hand. There are two types of treatments, surgical and medical management. Surgical is probably the most common. It's less invasive and much safer because they use an endoscopic approach and guided imagery to help remove the tumor off the pituitary gland. The goal is also to normalize the amount of growth hormone in the body. Medical management is used when surgery isn't available to the patient or they can't use it to treat the patient. There are a lot of types of medication available. GH receptor antagonists and dopamine agonists, which help control the growth hormone. This is a person with acromegaly. As you can see, the jaw, the frontal bones, they're very enlarged, and his jaw and his nose are also very enlarged. And here's a video of a person living with acromegaly.
So a system that's affected by acromegaly is the endocrine system. What this does is it works with the nervous system to control and regulate the body. It's composed of glands throughout the body that synthesize and secrete hormones, and the hormones are released into the blood and transported throughout the body. Some of the major glands are the thyroid, the thymus, pancreas, adrenal glands, and the pituitary gland, which is really important when it comes to acromegaly. So the pituitary gland is considered the master gland. It's located inferior to the hypothalamus at the base of the brain, and it's divided into posterior, which is right here, and anterior lobes. And the posterior is the neural part, while the anterior is hormonal and directly affects target organs and triggers other glands to secrete hormones. And what the pituitary gland does is it produces hormones that control body functions like metabolism, reproduction, and growth. And when it comes to acromegaly, this is caused by an overproduction of growth hormone by the pituitary gland. The excess production is produced by a benign tumor called an adenoma, and no matter what the size of the tumor is, it's always going to be benign. They aren't genetically inherited, but they show up later in life, so it's not at birth. And the tumors are a result of a genetic alteration in a pituitary cell that leads to increased cell division and a signal that tells the cell to secrete growth hormone and to divide. And the tumor can compress the brain structures, which, for an example, can lead to blindness, and the excess growth hormone production can lead to abnormal growth of feet, hands, and facial features. And this is an MRI of a healthy pituitary gland, while this one you can see is much bigger and that has a tumor on it. And here are just some more pictures of what the excess growth hormone can do. Obviously this hand is much bigger than this hand. That's acromegaly and that's a normal one. And then here's what can happen to your face. This is somebody without acromegaly, and this is somebody who has, their facial features are a lot bigger and are clearly affected by it.
Another system that's affected by acromegaly is the skeletal system, which provides protection and support to the body. It's a site of blood cell production and stores calcium and phosphorus. In the skeletal system, excess amounts of GH in a person with acromegaly affect the tissues and the bones of the body. Some symptoms can be large bones of the face. For example, your jaw and your tongue can be enlarged. Your hands and feet can be enlarged, and your teeth can be widely spaced. Bone overgrowth and organ enlargement are due to the prolonged overproduction of the growth hormone. That's just a picture of a girl who's a young adult there, and as she grows older, because she has acromegaly, her jaw enlarges, her nose, her hands do, and her forehead. In a healthy patient without acromegaly, the excretion of growth hormone by the pituitary gland is normal. Growth hormone regulates the stimulation of linear growth at the epiphyseal plate, increasing formation of cartilage and bone. In a person who doesn't have acromegaly, the continuing bone growth after adolescence doesn't happen, and their organs remain in size. A person with acromegaly, continuing growth of the facial bones, hand and foot bones, and enlargement of the jaw and spacing of the teeth occurs. Bone growth is affected by the growth hormone and IGF hormones, which are continuously excreted in a patient with acromegaly. Also, thickening of bones and tissue enlargement are due to the excessive secretion of growth hormone after adolescence, when the epiphyseal plates are closed and growth is no longer able to occur.
Another system affected by acromegaly is the cardiovascular system. The main goal of the cardiovascular system is adequate perfusion of all body tissues, transportation of blood throughout the body to allow exchange of substances between body cells and blood capillaries. This is how blood flows through the heart. It starts in the right atrium, flows through the tricuspid valve into the right ventricle, up through the pulmonary valve into the pulmonary artery to the lungs for oxidation, and then it reappears in the left atrium through the mitral valve into the left ventricle and through the aortic valve to the aorta and out to the rest of the body. The cardiovascular system affected by acromegaly can cause myocardial hypertrophy, which is swelling in the myocardium, which is the smooth muscle of the heart. In this picture here, you can see this is a normal heart with a thin layer of the myocardium around it. This is a hypertrophied heart, and the thickening of the myocardium around the heart eventually will cause loss of function in the heart and it will not be able to pump blood throughout the body. It can also cause shortness of breath, chest pain, and lightheadedness. Excessive growth hormone also causes elongation of action potentials and enhancement of contractile performance of the heart. People with acromegaly have a heart characterized by contractile biventricular hypertrophy, thickening of the ventricle chambers. Mortality of people with acromegaly increases because of cardiovascular disease.